Americans swapping candy canes for cough drops this holiday as cases of the flu are skyrocketing around the country. New York City being hit particularly hard with preliminary hospital data showing that the week before Christmas, more New Yorkers went to emergency rooms with flu-like symptoms than during any other week in the past decade. Exacerbating the issue, according to experts, this new flu strain has mutated in ways that help it evade the body's immune defenses, ensuring it's not an exact match for the virus included in this season's flu vaccine. So joining me now is Dr. Anahita Dua, Associate Professor at Surgery at Harvard Medical School. Thank you for being in, Doctor. Now, because this flu strain and vaccine are not a match, does that mean that those who got the jab are still at risk of contracting it?
Yes, if you get the jab, even if it is a perfect match, you can still be at risk of contracting it. The vaccine really is to ensure that if you are vaccinated, the type of flu that you get in terms of your symptoms are not so severe. I am a vascular surgeon, and while we talk about the flu, we always talk about a fever, we talk about coughing, we talk about breathing. But as a vascular surgeon, unfortunately, what I sometimes see in patients who have the flu is patients, unfortunately, where their hands and feet have actually died, and I have to go and amputate them because they get horrible flu that leads to sepsis. They're in the ICU, and ultimately they cannot get blood flow to their hands and feet. So severity of the flu is really important, and that's really where the vaccine comes in to help.
I see. Now, if people haven't gotten their flu shot yet, do you believe it's still worth them for them to get it now that we're almost into the new year?
Oh, absolutely, certainly. Because right now is really the peak of when we're seeing a lot of these cases. And of course, it's also Christmas time. It's New Year's time. It's when we're all hanging out with the family, when we're going out shopping. And so you're, of course, at high risk. And again, because it's Christmas time and because it's New Year's time, we're hanging out with grandma, we're hanging out with the kids. So it's really important to protect those people who are immunocompromised, those who are young, who can get really bad severity of disease. And so getting the flu shot, again, just prevents it from ideally spreading quickly, and of course, if you do get it, allowing you to get over it much faster.
I see. Okay. And let's turn to another really crucial headline here. The Massachusetts Department of Public Health has issued an advisory about possible measles exposures in multiple locations in the state. What should people be on the lookout for? And given the flu outbreak, what are the major differences here that people can keep on their radar?
Well, that's a really important question. So one of the reasons that we're seeing so many people sick is because indeed there's a concoction of different types of viruses that are out there. Aside from measles, you've also got RSV, COVID's always flying around, and now you've got this horrible influenza A virus, which is of course the flu. And so what really you need to worry about is when you're in groups of people, especially someone who may be sick, those sick contacts, because all of these diseases are so highly contagious, can affect you. So the key is to protect yourself, keep yourself hydrated, and ensure if there are sick contacts that they stay at home for at least a week to get over the process. It's really difficult to say when someone is in front of you sneezing, coughing, or with a fever, what type of virus they have. But indeed, as you said, there's so many things flying around. You need to protect yourself and just stay away and ensure that you're well protected.
All right, some critical health information for us today. Dr. Anahita Dua, thank you so much. Coming up in our next hour.